Hi, it's Dr. Kenneth Hughes in Los Angeles. I think a good topic to discuss would be liposuction revision and trying to help those patients who have problems with previous poorly executed liposuction or healing issues. Frequently, people think that this is that must be a surgical error. Quite frequently, it is not a surgical error. Quite frequently, it is a healing problem. I frequently explain to patients, if you give one individual a certain set of parameters, let's say it's diet and food and coaching, okay, and you give the other person the same thing for two athletes, let's say. Well, one could be an Olympic champion and the other one you never heard of, couldn't even compete in high school athletics. So it's very much that same type of logic that you can apply to almost anything as far as like intellect or wound healing or whatever the case may be. And so sometimes patients come in very frustrated and very adamant that something was done wrong in the first surgery. And my first order of business is trying to correct some of those preconceived notions, because quite frequently it is not a pure thing where there's some technical issue that was not executed correctly by the first surgeon. So that's number one about these things. And what that sort of that underlying message for the patient is, hey, Dr. Hughes may execute this procedure as perfectly as possible. In other words, it looks as good as possible on the table, but that does not mean that the patient will end up being happy with the result or that it will heal perfectly, okay? We're dealing with a very imperfect system. We're dealing with humans, we're dealing with organisms, and you have to realize that with those constraints, you will have less than perfect results. Frequently, sometimes when patients come in and they go, oh, your work is fantastic or something like that. Well, you have to realize that some of these things, they're points in time. Just like, if I have a patient send me something where they're modeling for something and they said, they're obviously making that patient up to look as good as possible at that one point in time. And depending upon camera angle and things like that, those things can be changed. And so when I'm trying to give these patients sort of an estimate or trying to gauge their expectations, they need to understand those things. And it's not as simple as, how will I look? There's no way you can predict that. But nonetheless, with regard to liposuction revision, probably the most common thing I see from patients. Some type of revision, but liposuction revision is very common. So frequently it's liposuction revision of the abdomen. Why is that? Because the abdomen is the least forgiving component of any area of the body that you liposuction, okay? You have to get the flap perfectly uniform. You have to liposuction it so that it's even throughout, okay? That means in the superficial and the deep layers. Without that, you're not going to get a smooth result. Never mind the fact that the patient can develop fluid collections, or they can have loose skin, or it can heal not as perfectly as possible. I'm talking about just getting it right on the table. That can be an incredibly difficult task because it's not something that you can teach, okay? It's more of an overall feeling where a patient, because it's a blind procedure in a patient, the surgeon has to know where he or she is in space, okay? Depth, and also, if you were doing a two-component array there, you have to know where you are on that grid as well at all times. And if you don't know where you are depth-wise and in that two-dimensional range as well, you're never going to know if you're doing the surgery correctly. So some of that is based upon, how well people or individuals can assess those types of things. So assessing where you are in space, assessing endpoint, assessing whether you've achieved that endpoint throughout, and whether or not it's uniform. In liposuction revisions, frequently what happens is the deeper layer of fat is kind of haphazardly entered, and so that's what yields these kind of hill valley. And so I have to go back in. You basically dissect through the scar tissue, lift the area up, and then you're kind of basically kind of shaving it down bit by bit until it's more even. And then frequently what I do is I use body tite on top of that to help the skin conform where there's a hill, okay? Make the hill shift down into where the valley is, okay? You frequently can't get a valley to come up, okay? Because it's a restrictive, retracted type scar issue where the superficial liposuction that was done before has created an improbability that you could possibly expand that through fat grafting, and that becomes very difficult. This is not meant to be an all-inclusive discussion. This is just to kind of whet the appetite for these types of procedures and discussions. But it is something that I see so often that I feel like a small video about that is something that will be worthwhile and helpful to patients searching for liposuction revision surgeons. I put, a lot of times these patients are some of the ones that feel the most kind of hopeless and whatnot, because it is a part of the body that people, show off with, in swimsuits and things like that. And there's no really getting around it if it looks, really unnatural. And so I frequently tell patients, look, I can improve these situations if you just get on board and we work as a team and you do everything in the post-op. I frequently can improve these a great deal. It's never perfect, but I can frequently get a lot of improvement. You can see that in the body type galleries and liposuction revision galleries, and even the lipo galleries. A lot of the liposuction pictures that I have in there, they've already had liposuction before. I mean, I don't explicitly state it, but frequently they do. So take a look at those. Take a look at some of the procedure videos that I do, and that should give you an idea of some of the expertise I have in those surgeries. Have a good day.